What if the real reason your legs feel heavy, swollen, or tired by the afternoon, especially after you turn 70, has nothing to do with your heart? Most people assume it's just part of getting older. They think poor circulation is something you simply have to live with, like gray hair, stiff joints, or slower mornings. But here's something that often surprises older patients when a surgeon explains it in simple terms. In many cases, the problem isn't your heart, and it isn't only your arteries. Sometimes, the real issue is a small group of muscles in your lower legs that have quietly stopped doing their job. Doctors have known about this for decades. Your calf muscles actually act like a second heart for your legs. Every time they contract, they help push blood back up toward your heart. But when those muscles become weak or inactive, blood begins to pool around the ankles and lower legs. That's when symptoms start appearing: swelling, aching, heavy legs, and that tired feeling that shows up by the end of the day. Interestingly, research supports this idea. In a 2021 study published in the Journal of Applied Physiology, researchers followed older adults who had mild circulation problems. They discovered something surprising. Participants who performed simple calf muscle activation movements significantly improved blood flow back toward the heart in just a few weeks. And here's the most interesting part. These participants were not running, they were not doing intense workouts, they were simply performing one very small movement that most people ignore because it looks too easy to matter. Now don't get me wrong, walking is excellent for your health, but walking alone doesn't always give these muscles the specific signal they need, especially after age 70. That's why many surgeons quietly recommend adding one simple exercise to support leg circulation and reduce daily discomfort. And today, I'm going to show you exactly how to do it. We'll start slowly and safely, the same way this movement is often taught to older adults in rehabilitation programs. By the end of this video, you'll understand why this small exercise can help your legs feel lighter, stronger, and more comfortable, without equipment and without strain. But before we begin, tell me two things in the comments. How old are you, and where are you watching from? I love seeing where everyone in our community is joining from. And if you enjoy learning simple, science-backed health tips for seniors, make sure you like, share, and subscribe so more people can find this information. Exercise number 3, supported standing weight shift. Now we begin introducing a movement where standing plays a bigger role. Exercise number 3 is called supported standing weight shift. After gently improving circulation through the calves, ankles, and knees, the next step is helping your legs relearn how to safely support your body weight. This exercise introduces standing in a controlled and comfortable way without pushing your balance or strength too far. To start, stand behind a sturdy chair or next to a kitchen counter. Lightly rest your hands on the support for stability. Place your feet about hip-width apart and stand comfortably. From here, slowly shift your weight slightly onto one leg. Then gently return to the center. Next, shift your weight toward the other leg, and then come back to the center again. The movement should feel calm and subtle. You are not lifting your feet, and you are not trying to balance on one leg. Instead, you are simply helping your legs and hips learn to share the body's weight smoothly. In everyday life, this ability to shift weight is extremely important. Every step you take, every time you turn your body or adjust your stance, your body must transfer weight from one leg to the other. When that process becomes stiff or uneven, circulation can slow down. Over time, this may lead to stiffness, discomfort, or fatigue, especially after sitting for long periods. According to guidance from the Mayo Clinic, supported standing movements can help improve circulation in the lower limbs and coordination between muscles and nerves, particularly in older adults who may feel less confident with balance. These gentle weight shifts help your muscles contract and relax rhythmically, which encourages healthy blood flow without the strain of intense exercise. To practice this movement, stand tall with your chest relaxed and your eyes looking forward. Slowly shift your weight to the right side, feeling the pressure through your right foot. Then return to the center. Next, shift your weight to the left side, and then return to the center again. Keep the movement slow, steady, and relaxed, breathing naturally as you go. If you ever feel unsteady, simply make the shift smaller or allow more weight to rest through your hands on the chair or counter. One common mistake is locking the knees or leaning the upper body too far to one side. The goal here is quiet control, not speed or large range of motion. Think of your weight moving like a gentle pendulum, smooth, steady, and predictable. For older adults, this exercise helps support better balance, improved circulation, and greater confidence while standing. It also builds on the earlier seated exercises and prepares your legs for the next movement, which is even more practical for daily life. Next, we'll move on to exercise 2, chair-assisted sit-to-stand. After your legs have been gently reactivated and your balance has started to return, the next step is to strengthen circulation through a movement that closely mirrors real life. Exercise number 2 is called chair-assisted sit-to-stand. This exercise focuses on standing up from a chair with control, which is one of the most important movements for maintaining leg strength and healthy blood flow after the age of 70. The movement begins while sitting in a sturdy chair. Place your feet flat on the floor with them positioned slightly behind your knees. From here, gently lean your upper body forward just enough to bring your body weight over your feet. Then slowly rise to a standing position. Once you are standing, pause for a moment and then slowly sit back down with the same calm and controlled motion. If needed, you can place your hands on the chair armrests or rest them on your thighs for extra support. In daily life, standing up from a chair is something we do dozens of times every day. Each time you perform this movement, the large muscles in your thighs, hips, and calves work together. This coordinated muscle action is powerful for circulation because it helps push blood upward through the legs while also building functional strength. When this movement becomes difficult, many people begin to avoid it. Unfortunately, that can lead to increased weakness and slower circulation over time. Information shared by Harvard Health Publishing explains that sit-to-stand movements can improve lower body muscle activation and support healthy blood flow in older adults when they are performed slowly and consistently. The key here is control, not speed, especially for people who may have knee or joint concerns. To practice this exercise safely, begin with just a few repetitions. Take about 3 seconds to stand up. Then take even longer to sit back down, lowering yourself slowly into the chair. Remember to breathe normally and avoid holding your breath during the movement. If your knees feel uncomfortable, try reducing how low you sit or use your hands for extra support until your strength improves. A common mistake is dropping quickly back into the chair. When that happens, the muscles stop working too soon, and it can place unnecessary stress on the joints. Moving slowly keeps the muscles engaged for longer, which improves circulation and builds confidence. For seniors, this exercise supports independence, reduces the need for assistance, and helps the legs feel stronger and more active throughout the day. It also prepares your body for the final exercise, where circulation, strength, and everyday movement all come together in a powerful and meaningful way. Exercise number 1 is called controlled heel-to-stand flow. Many clinicians quietly consider this one of the most valuable exercises for leg circulation after the age of 70. Not because it's difficult, but because it combines several important movements your legs use every single day. This exercise brings together calf activation, weight transfer, and standing strength in one smooth and practical motion. To begin, stand comfortably with your hands lightly resting on a chair, table, or kitchen counter for support. Keep your feet about hip-width apart. Start by slowly lifting your heels just slightly off the floor, feeling the muscles in your calves engage. Then gently lower your heels back down. Next, bend your knees just a little, as if you are beginning to sit down, but instead of sitting, simply straighten back up to a tall standing position. The movement flows smoothly from heel lift to gentle knee bend and back to a relaxed standing position. Slow, calm, and controlled. In everyday life, this pattern is extremely important. Whenever you stand up, step forward, or shift your position, your calves, thighs, and hips must all work together. When these muscles activate together, they help push blood upward through your legs, while also building the strength needed to stay independent and mobile. Many circulation problems actually develop because these muscles stop working together the way they used to. Guidance from the National Institutes of Health suggests that combining several lower body muscle movements improves blood flow and mobility in older adults more effectively than focusing on just one muscle group at a time. When multiple leg muscles activate in a smooth sequence, circulation support becomes stronger and more consistent throughout the day. To practice this movement, stand tall and relaxed. Slowly lift your heels, pause for a moment at the top, then lower them back down. Next, bend your knees slightly, then gently straighten your legs again. Keep the movement slow, smooth, and comfortable, breathing normally throughout. Start with a small range of motion and only increase it if it feels safe and comfortable. If you ever feel unsteady, simply use your hands more for support or reduce how much you bend your knees. A common mistake is rushing through the movement or turning it into a squat. That's not the goal here. This exercise is about steady, confident movement that your body can repeat every day. For older adults, this single movement supports circulation, balance, and independence all at once. If you were to choose just one exercise to help your legs feel lighter and stronger after 70, this is the one many health professionals recommend including in your daily routine.